Hi, my name is Jaimie Chau, and my proposed research topic is Ameliorating Psychiatry, a critical examination of American psychiatric healthcare. Some of you may be wondering, what does psychiatry have anything to do with public health and social change? Today I'm here to tell you that there's actually a lot of connections between these areas of interest. In regards to psychiatry, more work needs to be done to better represent people with mental illnesses coming from marginalized populations, as well as implementing better health policies and overall care. Personally, this research is important to me because as a person who experienced some of the ups and downs of psychiatric care, I really want to learn more about other people's experiences so that I can better understand and serve them as a future physician. Despite the sensitive nature of this study, I hope people will be comfortable enough to express their concerns to me, a person who knows what it's like on the patient's end and who isn't biased or affiliated with any hospital. On a greater scale, this research aims to underscore the dire needs of people using this service and to show lawmakers that, hey, mental health care is really important. These are the problems we currently face, and this is why we need to allocate more time, effort, and resources to this cause. As mentioned, this study is a research proposal, so I can only speak of the historical and modern context we have and my ideas going forth. With that said, psychiatry has a dark history, which may or may not influence our modern perspective of it. This includes the experimental atrocities from World War II, unethical phrenology procedures, and inhumane conditions at mental asylums. Most recently, there was an anti-psychiatry movement in the 1960s to 70s. And although that movement has been criticized and dissolved over time, in my personal opinion, some of the fears and concerns live on to this day, such as the overemphasis of the biomedical model and disregard of the social psychological influences. So where does this bring us? As crucial as it is to investigate the origins of social attitudes in greater depth, my research will act as a starting point for improving modern psychiatric care by identifying flaws to which dissatisfaction may arise. Essentially, I am interested in identifying the collective opinion of what exactly are people most frustrated about in psychiatry, and then getting a basic understanding of why that is. I hypothesize that the 5 main issues of psychiatric care in the United States are 1, poor social interaction or rapport with medical staff, 2, adverse side effects of medication, 3, lack of alternative care, which may be the type of therapy or counseling provided, or even the modality of mental health service, 4, financial burden, and 5, institutional problems, which can be the rules or regulations or even the environment of the facility. My main method for observing these potential issues is to release an online survey via Google form. Although certain details are subject to change, I plan to get opinions from people who are at least 18 years old with prior history of using in-person psychiatric services in the United States. The survey will have approximately 50 questions that are yes, no, multiple choice, and based on a Likert ranking scale. Participants will have 10 to 15 minutes to provide information about demographics, their patient-provider relationship, the efficacy, affordability, and alternatives to treatment, and any institutional complaints they may have. Lastly, the study will be confidential, as participants will be able to sign a consent form prior to the study. And that is all I have for now. I really hope to see what becomes of this research endeavor and the impact it may have on society as a whole, as we are becoming more aware and accepting of mental health. If you have any questions or suggestions, please feel free to email me at jaimie.chau@stsu.edu. Thank you.